How is awake brain tumor surgery possible? Understanding craniotomy. Imagine being awake during brain surgery. It might sound scary, but it is actually a carefully planned and safe procedure called awake craniotomy. The reason this is possible is because the brain itself does not have pain receptors. This means that surgeons can operate on the brain while the patient is awake and alert without causing pain in the brain tissue. During the surgery, a small part of the skull is temporarily removed to access the tumor. The scalp and tissues around the skull are numbed with local anesthesia, so the patient feels no pain from the incision or skull opening. This allows the surgeon to work directly on the brain while the patient remains awake and responsive. A key part of awake craniotomy is brain mapping, also called cortical mapping. Certain areas of the brain, known as eloquent regions, control important functions like speech, movement, vision, and thinking. When removing a tumor near these areas, it is crucial to avoid damaging them. During surgery, the surgical team stimulates small parts of the brain with mild electrical pulses. While this is happening, they ask the patient to perform simple tasks such as speaking, counting, or moving limbs. The patient's responses help identify which areas of the brain are responsible for these functions. This real-time feedback guides the surgeon to carefully remove the tumor while protecting vital brain functions. The entire process can take several hours. Throughout the surgery, the neurosurgeon works to remove as much of the tumor as possible while constantly checking the patient's neurological responses. A neuroanesthesiologist ensures the patient stays comfortable and pain-free, but the patient remains awake enough to participate in brain mapping. This approach allows surgeons to be very precise, especially when tumors are located near critical areas of the brain. Awake craniotomy has many benefits. It often results in fewer neurological problems after surgery, such as speech or movement issues. It also allows for more complete tumor removal, which can improve long-term outcomes. Patients typically experience shorter hospital stays and quicker recoveries compared to surgeries done under general anesthesia. Of course, like any surgery, awake craniotomy carries some risks, including seizures during the procedure, brain swelling, or temporary changes in coordination, memory, or vision. These risks are carefully managed by the surgical team. In summary, awake brain tumor surgery is possible because the brain lacks pain receptors, allowing surgeons to map and monitor brain functions in real time. This technique helps maximize tumor removal while protecting essential brain areas, leading to better outcomes and preserving quality of life. If you or someone you know is considering this type of surgery, it is important to discuss all options and risks with a qualified neurosurgeon who can tailor the approach to individual needs. Always seek personalized medical advice from healthcare professionals for the best care.